At this time, I would like to welcome each and every individual to the 20th anniversary of the Louis Stokes Library and Vernon E. Jordan Jr. Law Library Symposium. Today, we will begin with an introduction from the Dean of the Howard University School of Law, and then we will prepare for our keynote speaker. Please stay tuned.
Greetings, my name is Danielle Holley-Walker, and I have the honor of serving as Dean of Howard University School of Law. Today we are here for the symposium entitled Challenges and Legal Implications of Misinformation in Health Disparities and Health Policies that Affect Minority Groups in the United States. I want to welcome you to the second day of this milestone symposium presented by the Vernon E. Jordan Jr. Esquire Law Library together with the Louis Stokes Health Sciences Library at Howard University. The topic is health-related misinformation and disinformation in the news and in media messages, and their effects on minority groups in this country. The issues that the librarian selected for this symposium were born from witnessing the increasing misinformation surrounding health disparities. There is an overlap in research and scholarship in the law and medical fields, as well as a mutual desire to find solutions to improve the health and well-being of the underserved throughout our country and the world. The initial incentive for this joint symposium is the celebration of the 20th anniversaries of both the Law Library and the Health Sciences Library. They were both opened in 2001, in May and in September, respectively. The Law Library is still considered to be the new building on Howard University's beautiful West Campus. It is a gorgeous space, and if you have not been to see it in person, I really encourage you to do so. The architecture has received acclaim, and the Law Library itself has an important history. Our first librarian here at Howard University School of Law was A. Mercer Danielle, full name Alan Mercer Danielle, who was a trailblazer. As an attorney, writer, educator, and librarian, he started the library as part-time assistant in 1923. And over the next 35 years, he shepherded Howard's Law Library through some of the most important years in the history of our law school. Howard's Law Library grew significantly under his watch, and in 1933, the library met the standards for American Bar Association accreditation. A. Mercer Danielle then became the first Black member of the American Association of Law Libraries. In an era in which he was not allowed to stay in hotels where library conferences were held, he held leadership positions in the American Association of Law Libraries. Building on that incredible heritage, we were honored in March of this year, March 2021, to have our law library named after the great Vernon Jordan Jr., who was a trailblazer and an esteemed law school alumni and a civil rights icon. Human rights are one of the main tenets of Howard Law School's mission. The panelists we're invited today will speak about policy changes and strategies and about health justice and inequality-driven mistrust. They are at the leading edge of examining the challenges for law and global health in the digital age. Specifically, panelists will address misinformation regarding vaccines, medical conspiracy theories, and fake news, which are all detrimental to the health of racial and ethnic minorities and underserved populations. The Organization for Economic Cooperation and Development reports that in Australia, the European Union, and the United States, the spread of misinformation framing minorities as the cause of the COVID-19 pandemic has fueled animosity towards these racial and ethnic groups, motivating a rise in discrimination and incidents of violence in what has been characterized as corona racism. Some of the questions that you will hear addressed in this very important symposium are: how do we combat health misinformation on online platforms? How do we counter misinformation regarding vaccines? Should there be criminalization of medical misinformation? And in a time of information chaos, what are the most important solutions that can be put forward to answer some of these critical questions? Welcome to the second day of the symposium, and I hope that you will take all of the knowledge that is promoted at this important symposium and use it to improve and our communities during such a critical time in this nation's history. Welcome.
I am so happy to have enjoyed such a warm welcome from Dean Holley-Walker. With that, I will introduce myself and thank each and every attendee for joining us today. My name is Emony Robertson. I am a third-year student at Howard University School of Law. Welcome to day two of such a great symposium that is helping to push the conversation forward around health disparities. In day one, we were able to hear from our keynote speaker, Dr. Robert Pearl, who gave a thought-provoking talk on equity and inclusion issues in the medical profession. Then we heard from Irene Chen, who works at MIT, who outlined the role that artificial intelligence can play in treating health disparities. We also heard from Professor Carlo Nunziato from George Washington University, who spoke about the effect of social media platforms on health information, the distinctive problems that they present, and how to address these problems moving forward. And lastly, we heard from Dr. Monica Ponder, who discussed an interdisciplinary approach to crisis communication to frame messaging to safeguard public health. And today, we have the pleasure of extending this conversation. Now, we want you all to be engaged. I see that many of you are coming in and preparing for our keynote speaker. Feel free to drop questions in the chat. At the end of every point of this agenda, you will see I will answer your questions and address them. If we do not get to your questions, I apologize in advance, but stay tuned for a really great event. We're going to start with our keynote speaker. She's coming here as a director of the National Racial Equity Initiative for the Social Justice at the Congressional Black Caucus Foundation. Now we are going to delve into who she is and what she does. Olajumoke has this wonderful opportunity to speak with us today. She comes with extensive background in research, and I hope that you all engage with all that she has to present. At this time, we're going to log out of this session and log in where I will formally introduce our keynote speaker, and you will get to ask questions. We'll make that transition now.